Hello, my name is Angela Beckerman. I'm a licensed professional counselor as well as a licensed alcohol and drug counselor. I have been working in the counseling and psychology field for over 30 years. I have worked in different settings such as hospitals, treatment centers, counseling centers, and now I'm in a private practice. The purpose of this video is to introduce my counseling style, my counseling approaches, and methodologies that I use with people that are in my counseling sessions. I work with different mental health conditions and diagnosis, which includes anxiety disorders, depression, social phobias, bipolar disorder, schizophrenia, and also personality disorders, like people with narcissism or borderline personality. I've also worked very much with chronic addiction, whether someone is addicted to alcohol, cocaine, hallucinogens, or opiates. I've worked in 3 different treatment centers in which I've worked with medication-assisted programs such as methadone maintenance or outpatient Suboxone treatment. I've dealt with all levels of care that include inpatient and outpatient. I've worked with people who have co-occurring or dual diagnosis, meaning they have both mental health as well as addiction issues. Sometimes when people are anxious and depressed for a while, they resort to illicit substances and drugs in order to self-medicate for their symptoms. People who've had long addictions to cocaine, alcohol, any other drugs, their brain chemistry changes, which affects them, and they become very anxious or depressed. I also work with families and couples, particularly couples who are in recovery, whether it's for mental health or addiction. I usually find that it's very important to involve family and significant others in the treatment of clients. The most important thing that I want to stress in this video is my philosophy. I do not just look at the symptom problem, mental health condition, or people as addicts. I look at the whole individual. It's called the holistic or client-centered approach. This is because a problem, symptom, or condition has many causes or factors. Many factors can be physical issues, medical conditions, economic problems, past childhood issues, dysfunctional, unsupportive relationships, and current events that affect the well-being and how people think, feel, or behave. What's really essential here is I help people process how these factors have affected the way they feel and think, as well as how their symptoms are related to these contributing factors in their feelings, thoughts, and behaviors. Along with looking at causes of symptoms, I also explore different treatment modalities to address. And a couple of the treatment modalities I use is first motivational enhancement therapy. Sometimes when people come into counseling, they don't always know exactly what is going on and why the trouble is occurring in their life. Sometimes they have to identify why they want to change. There needs to always be a motivation, a reason. If someone's not achieving their goals, or anxiety and depression is affecting their functioning, or social anxiety prevents them from meeting people. These are all different issues that people may say, gee, something has to change. So this is one thing I use is motivational enhancement therapy. I also use cognitive behavioral therapy methods. In CBT methods, what I do with the client is I look how feelings are related to thoughts, how their thoughts are connected to feelings, and also how thoughts and feelings can affect behavior. If you can change one thing, a behavior or a thought, it may change the way you feel. If you change your feeling or a thought, it will change the way you behave. And again, this is all looking at symptoms and ways that behavior can change so people can achieve their goals and become happier people. I also use DBT methods or mindfulness. And this has to do with keeping people in the moment. Usually people can get very depressed about their past, very unhappy events, or they worry about the future and they have anxiety. DBT methods or mindfulness keeps the person in the here and now. They keep them focused on their feelings, their thoughts, and what they're doing now. In order to do this, I have found, particularly with anxiety, that breathing relaxation exercises really work. This is, with anxiety, there are many physical symptoms. There's fast breathing, fast heart rate, fast circulation of blood, and very tense muscles. When you slow these processes down through breathing exercises, slowing down breathing, this gives the chance for the body to slow down and for your mind to work, for you able to change your thoughts and then how you feel, and of course, and then how you behave. So these are just 2-3 methods that I use. You certainly, in my website, I specifically describe this in more detail. The last thing that I want to mention is, along with looking at symptoms assessment and utilizing some modalities depending on the condition that someone may have, I also continually look at if the counseling methods are working for the person. It's very important that you're always looking at the effectiveness, and how you know something's working is if there's a reduction in thoughts, that the problems or consequences of a behavior are stopping, and also, more importantly, that someone's life has improved in different aspects, whether it's work, family, or social relationships, and their self-esteem increases and their lives are improved. That's the most important thing about counseling. Right now, although I've been in different settings, I really feel that private practice is very important. I do not just do counseling, I do psychotherapy. I look at the person's past and present. I look at feelings, thoughts, and behaviors. I am particularly focused on why the client comes to treatment. What do they want to change? What were their thoughts about it? That's the most essential thing to initiate change. Every private practice gives me the opportunity to put extended time, effort, and attention on somebody. I look at every case, every individual very differently. And again, the treatment for each person may be different. So I hope that you've gained some information from this video about my counseling practices. This will help you introduce you to my website. I also hopefully, if you feel that you have any symptoms or problems, that this has helped you or encouraged you to seek your doctor's help or seek counseling. My contact number, if you have any questions, or certainly if you would like to set up an appointment, my schedule is very flexible, morning, afternoons, and evenings. You can contact me in many ways. First of all is my phone number, 860-227-7326. I have an email, angela.beckerman@gmail.com. And of course, you can view me on my website, angelabeckermantherapy.com. I also have a profile in Psychology Today and LinkedIn. I want to thank you very much for listening to this video that introduces my counseling approaches. I hope you can use this, or if you know any family friends that this might be helpful or counseling may be helpful, I hope you contact me. Thank you again and have a good day.